Yeah.
Is there a button we need to push?
That's right. Good morning, everyone. Today is Thursday, January 23rd. And starting on a somber note, a number of us are attending the memorial service for fallen officer Christopher Higgins from our Montgomery County Fire Unit, who died in the line of duty. Obviously, it's a stark reminder of the sacrifices that our first responders make every day on our behalf, and it is our duty to honor and recognize that service. And so we will be having a hard stop around 11 a.m. today to give enough time to be able to go. Today we have two items on the agenda. The first is an update on, let's see. The first is to receive an update on youth substance use trends and prevention and treatment services available to support youth. We're going to invert the order that was scheduled in the agenda. Makes more sense to provide the context and background with what's happening on the ground currently, and then from there talk about two special appropriations. Special appropriation 2530 to the FY25 operating budget, Montgomery County Government, Department of Health and Human Services, youth vaping and nicotine addiction response in the amount of $1,672,848. The source of funds is General Fund HHS restricted or other. This is from the Jewel and Altria settlement. So I will now turn it over to Ms. Yao just to tee this up and provide some context for the presentation we're about to receive.
The council has been, concerned about the crisis in illicit substance use, particularly fentanyl and opioid use of youth. And so this is a follow-up update that you're getting, as well as consideration of that supplemental. Dr. Davis is here to provide the update, and everything's teed up, so.
Wonderful. If our panelists could introduce themselves, and then Dr. Davis, go ahead and get us started.
All right, Dr. Keisha Davis, your County Health Officer.
Good morning, Monica Martin, Chief of Behavioral Health and Crisis Services.
And Sarah Rose, I'm the Director of the Local Behavioral Health Authority.
Wonderful. Thank you. Dr. Davis, the floor is yours, or whoever.
I'll get us started. First and foremost, thank you for the opportunity to provide this update. I know it's been some time. I know it's been top of mind for everybody in our community, this crisis. We're very excited to be able to, share our good news with you today. And as my colleague to the right here, Dr. Davis, says, throw out all the reasons why we cannot take our foot off the gas pedal in all the work that we're doing. And so while what you're going to hear about today is part of a national and state trend, again, we're very fortunate in Montgomery County to have had the executives and your support and our community support, many partners and residents in getting to where we are today. So with that said, we're going to first have Dr. Davis, our health officer, speak to all the data that you would ever want to know about where we are at this point in time, and then we'll talk about our active intervention and prevention efforts that are supported by the county. Thank you.
Thank you, Ms. Martin. So what we are going to do today, we're going to share quite a bit of data, and also I will say this is just scratching the surface on the data that's available. Late in 2024, the Maryland Department of Health opened a overdose dashboard, which we will see some snippets of that. It has data that you can splice, dice by county, age, race, ethnicity, gender, substance, death, overdose, Narcan. We can only show a little snapshot of that. So there's lots more information there. We also, thanks to our county epidemiologists, we also pull from EMS data for the fire and rescue team. We also pull hospital data, Essence data. So this is pulling from many different sources. Again, just a snapshot to kind of give you a picture of where we are with youth. This is just looking at national trends. You can see across the nation, drug-induced mortalities are down. That number for 2024, and these are calendar years, so we don't have the full. This is just the first half of 2024, but you can still see, even for the first half of 2024, is less than half of what we saw in 2023 in terms of drug-induced mortalities. When we look specifically at Maryland, I know this graph is hard to see. I'm calling your attention mainly to the fact that, let me go up one. Mainly to the fact that the graph on the left, the red line at the bottom, is youth. And we can see that the youth under 25, you can see that that trend has remained about steady, come down a little bit. I do want to draw attention, we are not talking about this today, but the purple line at the top is the 55 plus, and you see where everyone else is decreasing, that age group is increasing. And so as our substance use team thinks about priority areas, we have done a lot to focus on youth, but that 55 and older age group is also in our sights. The graph on the right is to show where Montgomery County falls in comparison to other counties in the state, and you can see in terms of overdose fatalities, we've had 10 to 100, which is about average in comparison to other municipalities. This is looking again in comparison to the state, just a snapshot of what you can see across the board. I will point your attention to the lower right corner, which is showing opioids or overdoses by age group. That first bar of under 25 is blank for both boys and girls because that number is under 11, so it's suppressed. It doesn't mean that there was 0, it means it was under 11. When we look at fentanyl, alcohol, cocaine, heroin, and PCP collectively for youth, it is less than 11. So overdoses for those other substances have been low in youth under 25. When we look more specifically at Montgomery County, you can see on the far right of the graph is the numbers from 2024. This is going through the end of December. This is data from the Office of the Chief Medical Examiner from the Maryland Department of Health. We had 83 fatal overdoses in calendar year 24, 48 included fentanyl, 81% were male. And again, this is all ages. We saw a 40% decrease in fatal overdoses and a 52% decrease in fentanyl. And when we look at youth under 22, age 22, there were less than 11 overdose fatalities in both 2023 and 2024. And even when you add them together, you still continue with a suppressed number of under 11. The top zip codes with overdose fatalities are now shifting. So in 2019, the top zip code was Gaithersburg. In 2024, those top zip codes are Silver Spring and Wheaton. And this is just showing, again, this is overdoses of all ages. In youth are in red. You see in Montgomery County, they didn't even show on the map until 2020. When we look at the under 21 age group, and again, this is just for fatalities, there were no cases in the under 18 age group. In 2019, there were no cases in the under 18 age group. In 2020, 2022, and 2023, we saw increases in the 18 to 24-year-old group, driven mostly by an increase in Hispanic and African American youth. In 2024, this trend is finally starting to turn, and we've only a couple of cases are from the under 21 age group, mostly from the Hispanic and white group. Again, when we look at county data, you can see that trend broken out by age. This is ER visits, opioid-related ER visits for youth under 25. You can see that, dramatic increase in 2023. In 2024, while we did see a decrease across the board, I do want to draw your attention, to the 2020, to the 15 to 17-year-old age group in 2024. So even though we saw a decrease across the board, that age group did increase. I also just want to highlight in terms of gender, I don't show it on the slide, but when we look at the 15 to 17-year-old age group, we see a higher rate of overdose in girls than we do in boys, and often the conversation that we are having is around boys, and we need to make sure that we are thinking about our girls in overdose. When we look at under age 14, girls and boys overdose at about the same rate. At that 15 to 17-year-old age group, girls pull ahead, boys start to pull ahead over 18, and then over 21, boys pull far ahead. And then when we look at that broken down by race and ethnicity, Hispanic and African American groups showed higher counts compared to 2018, while whites showed a sharp decline. You can see that minority groups fared worse through the COVID years and still haven't quite recovered from its impacts, and Hispanics have showed the highest counts. And then just looking at the zip codes, on the left, you have 2023, and on the right, 2024. The gray areas are places that had at least one, but less than 11 incidents. And so you can see the counties that are gray, the 20878 had 17, and the 20904 had 14, and then you can see those pretty significant decreases, 10 and 11 in 20902 and 20906, I believe. Just looking at the trend, specifically, again, in ER visits for opioid overdose, you can see the breakdown by age from less than 18 and the 18 to 21-year-old age group. And then looking at Narcan administration. So EMS data does not include race and ethnicity data. They only collect that for race info and cardiac emergencies. In 2019, only 1% of patients refuse transport to the hospital. However, more recently, they see up to 10% are refusing transportation to the hospital. In terms of Narcan administration in schools, this is often asked. We only have data on when EMS is also called. The numbers are low. No school had more than one incident. There were no more than, it was under 11, so we can't share the numbers, we can't share the schools. But the numbers are half. In 2024 calendar year, the numbers are half of what they were in 2023, and not half of what they were in 2022. So we've seen significant decreases, and all of those decreases remain at less than 10. And the last 2 years have been only in high schools. With that, are there any questions on the data before we transition to talk a little bit? Okay. All right, I will transition. Sarah.
Great, thank you. Thanks so much. Okay, yes, so I'm going to just provide a brief overview in terms of the services that, of the youth substance use intervention efforts that are supported by HHS. And the first one is our newest program that has come online. This is our residential substance use treatment program for withdrawal management services for youth. And this contract began on August 31st, 2024. We were, due to the increases in adolescent substance use, particularly with opioids and the increased overdoses, we were finding that there was a very strong need for this level of care that did not exist in Maryland at that time. And so we worked closely, the LBHA worked closely with the Maryland Department of Health's Behavioral Health Administration to obtain variances to licensure for our local adult program. And so from August 2023 until current, it was a total of 39 variances that were approved for youth on a case-by-case basis to be able to be admitted into the adult program. Obviously, that's not an ideal situation when we have an adolescent and adult program. So concurrently, we were also working with the state to find a way to get one of the programs up and running as quickly as possible. In the entire state, there was one program that maintained licensure and accreditation for serving youth for withdrawal management, and so we were able to work, again, closely with the state to get that program up and running. So far, since opening, there have been 26 youth who have been admitted to the residential program, 15 of which were from Montgomery County. And there has been a 77% completion rate, and the average approximate rate of stay is about 14 days. The provider is also working on updating the building because it had been closed. The wings for the adolescents had been closed for quite some time, and so there was quite a bit of extensive updates that were needed in order to make it a safe and appropriate place for the adolescents to stay. And from August 31st until current, it has been available to males only. However, starting on Monday, the 27th, it will be available for all referrals. So we're really excited to share that information. For our intensive outpatient treatment program, we have the Journeys program, which is located in Rockville. They have served, in last fiscal year, 177 youth were served, and quarter one, 64 youth were served. For the completion rates, they are relatively low. However, we're finding that that's pretty common across the board when there's just due to the difficulty and challenge of engaging and getting the youth to completion. This program is operating in a hybrid model where the assessments are performed in person, and then there's once per week there's an in-person session, and then the other two sessions are virtual. We're finding that there's been comments about youth sometimes preferring to attend virtually, that sometimes it's easier, especially when they're going multiple times per week into a treatment program. For Suburban Hospital Addiction Treatment Center, this is our contracted level 1 and 0.5 early intervention program. This program, last year they served a total of 30 youth, and Q1 there's been 7 youth served so far. There has been low numbers, and so there's been significant outreach to inform the schools and community that this program is available and accepting referrals. The good news is there's no wait list for these programs, and there are also other programs throughout the community that also accept clients that don't have the direct contracts with HHS. And so we are finding that there has been increasing over time, increasing rates of engagement and participation in adolescents over the past several years. It's about 5 to 10% increases year over year. So that's the good news. We also have a contract with Shepherd Pratt for the Adolescent Clubhouse program. This is where they provide a family and peer support and really making sure that youth who are in early recovery have the social supports of friends and peers, and they're able to connect in pro-social kinds of ways. And so last year there were 56 youth served, and this year 31. And we also have the SUD, the Substance Use Disorder Emergency Prevention and Intervention program with Identity, and this contract began on Valentine's Day of last year, on February 14th, and there's been targeted outreach to youth, in particular within the Aspen Hill, Wheaton, and Glenmont areas, and they're connecting these youth to treatment services and other needed resources. So in total, there was so far 1,100 youth and adults have been outreached, and there have been 40 youth who are receiving intensive case management and connections to services, 34 of which have been referred to substance use disorder treatment and 14 to mental health providers. We also have the Child and Adolescent Assessment Services program. Is not on the graph, but this is another program wanted to touch base with you all about, that we have a team of clinicians. There are currently 2 therapists who provide screening and assessment for youth with mental health and substance use concerns, either or. And so far this fiscal year, the first 2 quarters of FY25, there have been 227 youth who have been screened, and the referrals are provided for treatment services and supports as needed.
Thank you, Sarah, for that overview. I just need to highlight again, I know we've all heard it before, but we need to be reminded of just the chronic nature of the disease of substance use disorder. The fact that our youth, we know our brains are not fully developed till we're 25 at least. That's what science tells us, has told us for many years now, and that engaging in substance use treatment it's a very difficult choice to make with the addiction process, and maintaining treatment compliance, as well as the recovery process, which involves multiple relapses for most, and for youth, more than multiple on average. When we talk about the completion rates and everything that Sarah just talked about, we just know that we're having ongoing conversations with providers. Some of them have done much more intensive outreach in the last couple of years. I just really want to thank Sarah for her leadership in doing that. But that in and of itself is not always enough, because we're not in a place and space in this county or in the state to mandate youth into treatment. So just a reminder of the difficult uphill work that we have in front of us, and that we have been working with. So where we want to focus our efforts whenever we have the opportunities in prevention, to prevent, youth and young adults kind of falling off that cliff and being afflicted by substance use disorders. So here's an overview of, and this is not exhaustive by any means. When we talk about prevention, we're talking about addressing root causes and social determinants of health, and we have so many more programs in the county. You're aware of many of them that are, doing a rich and amazing job in addressing those things. Many of those are housed in children, youth, and families, and you'll hear about some here today with the dual appropriation, but primary prevention is key. Universal prevention is key. We know this. But in terms of some targeted efforts here, the first option, the first element that you see here on this chart is not something that we fund, but the Maryland Community Health Resources Commission did extend grants last year. They're an independent commission within Maryland Department of Health. And so they're currently funding 8 service provider grantees, 2 of which provide substance use focus services for youth at MCPS. So one of those is Tree of Hope, and they have a primary focus on providing peer services for middle and high school students with substance use concerns or at risk of using substances. I just want to highlight there too that they're doing work beyond this grant to expand their peer recovery support services with youth leaders. They have, at this point, when I came into this position, it was 2, and now they have 4 youth peer leaders that are responding to emergency rooms to see youth in the emergency room. They are starting partnerships with fire and rescue and EMS around having youth peer leaders connect with youth in the community. But again, by virtue of this grant at this point in time, doing a lot of work in high schools as well specifically. And the other grantee is Identity, who is providing care coordination services for substance use affected youth through this grant, apart from the emergency intervention work that they're doing that Sarah talked about in the community. So the Local Behavioral Health Authority is the pilot hub for this effort and collaborating very closely with MCPS for the expansion of behavioral health services here in Montgomery County for youth. The next round of grant funding was released and is due February 4th, very soon, for the Consortium on Coordinated Community Supports. And that was intended to make available up to $120 million in new grant funding across the state to support current and expanded behavioral health services. This is from pre-K through high school, the whole gamut. However, the companion bill to Governor Moore's proposed FY26 budget, the Budget Reconciliation and Financing Act, it would make permanent a $90 million annual reduction in school behavioral health funding specifically provided by the Consortium on Community Supports. So that may not be as robust an opportunity moving forward. In terms of life skills, I'm sure you've all heard before about the BOPN life skills, longstanding evidence-based prevention curriculum. It's available at many different developmental levels for middle schoolers and even upper elementary schoolers. So expanding that effort to provide more of that programming in secondary schools in particular. We've had more facilitators trained, including a lot of youth serving community organizations that provide services in schools via contracts with HHS and not just in behavioral health and crisis services. I can tell you right now, currently there are groups being conducted at Martin Luther King Jr. Middle School, at Neilsville Middle School and Parkland Magnet Middle Schools. And that effort, which starts with one-time presentations and engages youth in the ongoing 8-session curriculum, has reached 525 unduplicated youth at this point in time. We continue to expand the Be the One Youth Ambassador Program. We're very excited that membership has more than tripled. At this point, we've got 53 youth ambassadors representing 13 schools. Those are 12 MCPS schools and 1 independent school. We have 3 peer leaders that are going to be attending the Community Anti-Drug Coalition of America's National Forum next month, along with HHS staff and community advocates, and that's to catalyze planning for further expansion of peer-led awareness and prevention activities. And then we are doing more in the general community public awareness space efforts with the use of health behavior change content. So we're working with MCPS, with our boards, committees, and commissions, AODAC, and the Mental Health Advisory Committee, and community partners to plan 3 more events in 2025 to increase awareness about concerns and ultimately promote substance-free and healthy lifestyles. These events are going to include resource fairs, and we'll have local providers invited to share specific information on services and supports based on the communities that the events are held at. We also continue to expand efforts to address the risk factors of social access and social norms around substance use, especially with the legalization of cannabis. This is done through collaborative efforts to continue with the drug take-back efforts, the social marketing efforts that we have in place, and utilizing input from youth to educate youth and caregivers. So again, those efforts include partnerships with local law enforcement, our youth ambassador programs, HHS, and various community interest groups. In terms of how we engage, next slide, please. Yeah, how we engage. I skipped over one piece. The emergency intervention and prevention program was started as an emergency procurement in March, February actually, of last year. We do have an RFP that is almost done in its process for awarding. We expect in March to have a new contract in place. It will not be an emergency procurement, that expands that community-based outreach and engagement and identification of youth and young adults using substances to the whole county, so not just targeting Wheaton, Glenmont, and Aspen Hill moving forward. So we're excited about that. In terms of working with various partners on substance use-related issues, this chart tells you a little bit more about our overdose prevention team. It was formerly named the it's now the overdose prevention team. We do this all the time. It was formerly named the opioid intervention team. And this is a body that is required by the state to promote multidisciplinary collaboration and expand substance use-related supports, specifically Maryland's Office on Overdose Response, and is responsible for developing a local strategy in every jurisdiction to reduce overdoses and to host meetings and discuss updates. So this body must be chaired by the local health department, and Dr. Davis is our valiant chair, and co-chaired by local partner organization, and right now that's Second Chance Treatment Center. It includes partners, again, this is a state requirement, includes partners from 8 sectors, and you have the names of the agencies and organizations that represent those 8 sectors in your packet, but the sectors are health, social services, education, public safety, harm reduction, recovery support programs, treatment programs, and community and faith-based organizations. So it's a broad multi-sector gathering. The state requires us to meet quarterly. We have been meeting monthly. We are at a place now where we may be meeting a little less frequently, maybe every other month, not quite quarterly. And this is also the entity that is responsible for giving us ultimate advisement on our recommendations for the use of opioid abatement funds, as well as any grants from the Maryland Office on Overdose Response. We also have our Alcohol and Other Drug Addiction Advisory Council, and we know that that's a BCC here, a board, committee, and commission here in our county government. The representation of that body in terms of the voting membership by county charter includes members of the public, at least 5 members that represent the geographic and cultural diversity of the county, at least 1 individual in recovery, at least 1 professional who treats substance use disorders, a person of high school age or younger, a practicing physician, a pharmacist, a relative of someone who's currently in care for substance use disorders, and a member each of the clergy, the legal profession, the PTA, any PTA association, and the business community. So they meet monthly. I know that they have shared their priorities for this year with you previously in the fall. And then we also have our overdose fatality review team, which does exactly what it sounds like they do. They review the specific details of any fatality due to overdose here in Montgomery County, and that's to identify safeguards to implement in our systems of care to help us in preventing future fatalities. So that is a smaller, medically focused team. It includes members of public health services, behavioral health services, our LBHA, corrections and treatment providers. So we are working on aligning the efforts of these groups to ensure that everything that's happening in one group is informing the other. And we're currently in conversations with them about promoting maybe some more shared meetings together to kind of just really enrich that exchange and our shared learning and collective impact. And ultimately, I just want to make sure that I take this opportunity to thank all the community organizations that are involved with us in these groups and bodies. Their discussions with us have really helped us to develop evidence-based or culturally informed practices that have really evoked change in our work. So I will just, it's not in your slides here, but I will just share that with regards to the listening sessions and the community input that we garnered through virtual submissions and through meeting with different stakeholder groups around the use of the opioid abatement funds. You will not be surprised to hear that the overarching number one theme that came out of those is that we still need to increase our upstream prevention education. So again, lowering in age and doing that in a targeted manner in upper elementary, starting in upper elementary. So we know that about 86% of youth who are engaged in fentanyl youth have started that by middle school, have at least tried it the first time in middle school. So we need to get into the elementary space to do that. We also heard a lot about additional parent-family education and support. And so in the future, you may see something come before you around increasing our capacity to do more of that more broadly. Okay, with that, I think we're going to move into the dual appropriation. Yes. Yeah.
Actually, before we go there, we're just questions on the presentation and the numbers. So obviously, any death is tragic, and this impacts families, but it is good news that numbers are decreasing. And I know it's in no small effort to the great work that you all just highlighted. I just had one general question, and I'll turn to colleagues. The first is, obviously, we were all deeply concerned when MCPS announced that they were going to be eliminating their health officer position because they had really established a lot of the infrastructure and what had been on the front lines, particularly during COVID, which we know was successful. It sounds as though the transition, I'm sure, has been not without its challenges, but can you just describe generally what that relationship has been like and what we have been able to continue, or what have we lost as a result of not having that position within MCPS?
Sure, I can talk a little bit. So I think the transition was bumpy in the beginning just because it was so abrupt. But I really do thank Dr. Kapunen and her team for many of the foundational pieces that they laid, because they have now helped things to go a lot more smoothly now. The work that they did in expanding Narcan in schools so that kids could be able to carry, that has been extremely helpful. And a lot of the education that happened to administrators and staff under her watch in collaboration with HHS and Ben Stevenson has been really helpful. Now that work, the Narcan administration has transitioned over to Dr. Chester Connolly, who's also the acting principal of the RAP program, which is their recovery and addictions program, which is actually really great synergy. She also is their chief psychologist, so overseeing their mental health programs. We continue to have a close collaboration. She now sits on our Commission on Health and many of our substance use groups. She's on the overdose prevention team, and so continue to have that close relationship both with her, with their safety office through Chief Jones. That collaboration has continued, as well as the collaboration with our school nurses. And so the fact that the school nurses are actually HHS employees allows us to really have continue that close collaboration with MCPS. So bumpy in the start, at this point we have gotten into a decent rhythm. I would encourage MCPS, we are still looking for that dedicated coordinator position to be the liaison between MCPS and HHS. We have several people that we go to and have good relationships with all of them, but having that key coordinator liaison between MCPS and HHS would be helpful.
I appreciate that.
The thing I would also share is that I'm sorry that Ben Stevenson, our manager for prevention and harm reduction services, couldn't be here this morning, and that's explicitly because he's attending a training that is required by the state to continue getting some of the grant funding that we need to do this work. But if he were here, I know he would share, I want to share on his behalf, that the ongoing collaborative work looking at the health curriculums and looking at those earlier grades that we just mentioned and talked about, he's been engaged with that in MCPS with Care Grant over there, and again, Dr. Chester's unit. So that had been in place before, but all of this collaborative work, and again, the new synergies we have in place with psychological services have allowed that to move forward. And so we're excited about further collaboration there.
All right, I'll yield to Councilmember Luedtke, followed by Councilmember Sayles, to ask questions about the presentation, and then after those questions, we'll then transition to talking about the appropriation. Councilmember Luedtke.
Thank you. Just to clarify, is Dr. Connolly Chester the designee for the school system as the Behavioral Health Services Coordinator?
Yes, so she is managing behavioral health, but we also have a different contact person that we use for kind of our immunizations program. She's the main contact for behavioral health and EpiPens, but somebody else that we work with for immunizations and different things, so.
Okay, I was asking just because the state requires that each school system have a person who fills that role, and that is the person who's supposed to be that coordinator with all the other, related agencies, both inside the county and then also at the state level. And so, to your point about making sure you have an appropriate liaison, it would be good for, to get some clarity on who MCPS has designated to fill that particular role, since that would be their job to help coordinate both at the state and local level. You mentioned 3 middle schools where the Botvin Life Skills Program is underway, and the 520 students that it serves. With this expansion, what is the estimated impact that it'll have?
Yeah, and that is just a snapshot of right now, right? Those are 8 sessions, and then we can move on to other schools. For example, one of the training elements is to train all of our youth development specialists at all the Bridge to Wellness schools. So every group can have around 12 participants. Okay. We can provide those as often as these facilitators moving forward have the opportunity to engage with students, and it's an issue of coordination like everything else that we do in the school-based space in terms of pulling them from class and time out of class and making sure it's a proximal time or it's after school. But by the end of the fiscal year, I imagine we'll be at 1,200 at a minimum. What we are working on is a framework to make sure we're capturing the full reach of that, because our focus is to have more trained facilitators out there and more trainers that can train more facilitators out there to really spread this very broadly, so that any smaller community-based organization, if they have someone who's interested in it and can do it and can incorporate it at any time they see fit, for example, in their after-school programming or in their Sunday school programming or whatever makes sense. So we hope the reach to be broader than that. And
Okay. And then I know that, in terms of expressing the different programs, and I'm glad we finally do have those to serve our adolescent population, and I appreciate the heavy lift it was in getting all the exceptions done, and now making sure we have facilities for our female adolescent population come Monday morning. But those were very focused on fentanyl and opioid, but in terms of other substance use disorders that are non-opioid and non-fentanyl, what are you seeing in terms of participation in those programs, specifically with respect to our adolescent population?
Yeah, we're finding overall the numbers have been increasing in terms of the engagement. I have the breakdown about more detailed information that we can circle back on.
Thank you. Yeah, it's almost, quaint, the whole notion of alcohol addiction in our youth population, but it still is an issue because alcoholism is itself a substance use disorder, so is nicotine dependence, right? So it would be good to know sort of, obviously fentanyl and opioids have a very quick lethality potential. And so, of course, that's where a lot of our attention has gone, but we want to make sure we're also focusing on those and on coexisting where it's more than one substance at the same time. So that would be great information for us to have.
previews of coming attractions. In Jewel, there's a slide that addresses those, so, but just in general, the rates of cocaine, steroids, heroin, meth, and ecstasy in kids in Montgomery County youth is less than 2%. So
Okay.
we'll see from the Youth Behavioral Risk Survey, and then I'll also show the numbers on alcohol, inhalants, and some other drugs.
Thank you. And I know, the data that we looked at, and thank you for putting that together, is a lot about, there was one slide that was about ER visits on overdose. Were those only the non-fatality overdose cases that went to ERs, or were they both fatalities and those where they were able to survive?
So any.
Both, okay. And the data that, when we're focusing on overdose and also whether fatal or non-fatal, we use that as a proxy for use, but we don't really have a great way to know overall use, particularly when we're talking about having done a great job, I think, and continuing to do great work in the education and availability of Narcan. So what, if anything, do you have available to you that you've seen in your work that suggests, aside from we're having less fatal overdoses, that suggests a decline in use?
So the best survey that we have is the Youth Behavioral Risk Survey that's done every other year through the CDC, through the state, that's done in the schools. The challenge is that there's a 2-year delay on that.
Right.
But it's going to get to actual use. It's done anonymously. In the past, it was done at just a sampling of schools. Last year, it was done at all schools. And the next one that they are in the process of doing for this school year. So I'll share some of that data. Those trends also are looking towards a decrease, but again, it's a 2-year delay. So the last data that we have is 2022,
Right.
when the big peak was in 23.
Right.
So that's also kind of just the data challenge that we face.
And I know you did highlight in an early slide the 55 and up population, which I know Baltimore City has highlighted quite a bit in its own work within its health department there. And so I look forward to having a subsequent discussion, particularly in our older population. And I hesitate to say older as I am 51, but that we've spent a lot of time talking about youth. What are the factors and circumstances that lead to that level of use and addiction of opioids in our 55 and up population? So look forward to circling back. Thank you.
Yeah, and, we know economic conditions often lead to those, and so we're all bracing ourselves over the next 4 years. And we're not going to talk about it today, but 2 of the top 10 programs most likely to be reduced are opioid prevention programs at the federal level, and that's going to have an awful trickle-down effect. So, but we'll cross that bridge, I guess. Councilmember Sayles.
All right. So thank you, Dr. Davis and Ms. Martin, Ms. Rose, for the presentation. This is all important work, and so I'm so glad that we're talking about this ahead of budget deliberations. As the council's lead for eliminating disparities in public health, I'm also eager to look at the racial disparities that exist, and so I'm glad that those were highlighted in this presentation. It also ensures that we are deploying appropriate services in the appropriate geographic areas. And so I just had a few follow-up questions regarding some of the programs. You partially answered this question regarding the racial and, the racial demographics, but related to the opioid and fentanyl-related deaths last year, are there any geographical references regarding those deaths, like where those individuals lived, where these incidents happened? I noticed that some of the grants are targeting particular areas. And I know that it was primarily Latinx, but didn't know if there were any other geographical references.
In terms of deaths, I would say the numbers are too small because you're talking about, I mean, yeah, the numbers are just too small to highlight any one geographical area. So that's, I think, why we've used more of the ER visits and use it. And so in those numbers,
It was one of the first
you can
slides.
see in the
Yeah, it was at
here,
the beginning.
kind of the zip codes of ER visits. And so targeting kind of this down county area.
Yeah, that looks like, is that East County?
Yes, down East County, 20906 and 20902.
Okay, because I noticed that some of the grants were focused on Wheat and Glenmont, and so are there any programs specifically focused on this part of the county?
So thank you for asking that question. That's exactly why the RFP that is replacing that emergency response, that was an emergency procurement, is broadening its reach to be countywide. It is specifically so that the provider, by virtue of how the RFP is written, will need to follow and do outreach to any hotspot as the data evolves over time. So when we're looking at this, and yes, some of those zip codes are still kind of Aspen Hill, Wheat and Glenmont area. But the reality is that our current provider didn't have the capacity to respond and certainly had calls coming in from other areas. And so while that was a focal point, we want to make sure that moving forward in our regular procurement, we have the ability to be to flexible and to respond to the changing trends in terms of geographic areas, but also in terms of target populations.
Thank you. I know that Narcan is widely available. Students have it. I was in Annapolis last night at an event for ER physicians who were talking about having it at their homes because they never know who can, encounter this issue, especially if they are in a remote area. Are we getting any exit information from anyone who has been near an overdose? If they have received care but are still, I don't want to say habitual, but it's a recurring incident after receiving care from any of these specific programs?
So in conversation with our EMS partners, was noted the challenge of getting people to go into treatment. And so, as we were saying, 5 years ago, nearly everybody who was offered a trip to the emergency room took it. Now they're seeing a higher refusal rate where they'll come to the scene, provide Narcan, and then folks will refuse to go to the emergency room. The police do investigate all overdoses to try and leave behind Narcan and leave behind education for families. But you also can't drag somebody into treatment. And so that is a challenge that we face. I was also talking with our EMS colleagues about a buprenorphine program. So you may have heard in other jurisdictions where they'll do a start in the field. So they will get Narcan and then buprenorphine right on top of that. And the challenge that they've heard actually across the country is that people are refusing. And so even in Frederick County, which has touted the program, presented at MACO, they've actually had only 2 people accept that induction start, and the acceptance rates across the country for programs are less than 5%. And so it's a challenge because it really is such an amazing program to, reverse the overdose and then start somebody into treatment right away, and have had a hard time with having folks actually be receptive to receiving that treatment.
Thank you. Reopening Mountain Manor Treatment Facility for the adults was a huge victory, but the distance can pose a challenge for some of those seeking treatment. Are there any wraparound resources in the county that we're connecting our residents to?
Yeah, so the great thing is when youth need to get into the residential program, there's actually transportation available where they will take them to the facility. And so we were sure to include that as part of the contract so that people were able to access.
Okay, and then the Be the One Youth Ambassador Program, you said that they were at 13 schools. Have we had any overdoses documented at any of these schools? And then, are there any successes or light bulb moments from this program that you have captured regarding reducing usage, prevention, otherwise?
Yeah, I am aware that there is at least, they're definitely in that 13. I don't have the cross-reference for you right now, so let
Okay.
me follow up with you on that.
Definitely.
And have Ben follow up with you on that. But I know just from conversations that there's at least 1 or 2 schools where overdoses occurred where we have ambassadors in this program. And in terms of the aha moments, I would offer that youth are in the best position to share those with you, and they're very excited about their growth and development. So perhaps there can be an opportunity for them to speak for themselves about those.
I love that. Thank you. The overdose prevention team has community members involved. Are there any community feedback references that you're either soliciting or have received on the deaths to influence program efforts moving forward? Are we getting anyone with lived experiences at the table?
Yeah, so in the listening session, we had both youth and parents and other family members of youth with that lived experience that provided input right here in this room, actually. And our virtual submissions that we received did include at least one individual. I don't want to say any more than I know is accurate with lived experience as well. As I mentioned, the AODEC charter requires that you have at least one representative with lived experience there. And we know that in our cross-sector representation in OPT, we also have individuals with lived experience. So
Good. Okay, my last question. The OPT is responsible for developing local strategies to reduce overdoses and discuss updates. Have they made any recommendations on any of the overdoses to prevent them, reduce fatalities since its inception? Because I believe it meets quarterly, right?
So per the state, it's required to meet quarterly, but we've actually been meeting monthly for quite some time with the development of the original allocation of the opioid abatement funds. Yes, they were one of the voices out of many stakeholders who have been focused on expanding prevention efforts, but they've made various other recommendations as well. My tenure with them is shorter than Dr. Davis's, so I'm going to look to her and see if there are other things that you want to share about their recommendations.
Sure. So their recommendations drove the supplemental appropriation that was approved by council last year that was a lot of these programs. So the funding for the Maryland Treatment Centers, expansion of the Botvin Life Skills, expansion for Be the One, the SUD prevention intervention targeted programming in Wheaton and Aspen Hill. So all of those funding recommendations came out of the OPT and the listening sessions that they conducted. And with the listening sessions that we have now conducted this round, look forward to another round of recommendations and a supplemental appropriation for the opioid abatement funds. So that will be coming to you soon.
All right. Thank you, ladies.
All right, let's transition to the supplemental request.
All right. Okay, so the dual supplemental appropriation settlement provides a transformative opportunity for our county to address the far-reaching effects of the youth vaping epidemic on our community. These funds, as outlined in the settlement agreement, are to be used for compensatory restitution or remediation of the past, current, and future damages caused by the vaping crisis, and the county attorney has affirmed that these terms should be broadly construed. This allows us to invest in meaningful public health initiatives that address both the direct and broader impacts of youth vaping and mental health and its associated challenges. We propose allocating a portion of these funds to 2 vital programs, Beyond the Gloves and Street Outreach Network. Both initiatives focus on empowering Black and Latino youth and target high-impact zip codes that have been disproportionately affected by the vaping epidemic. Research from local data confirmed that Black, Latino, and low-income youth have faced higher exposures to and harm from vaping, along with the intersecting challenges of systemic inequities in health, education, and safety. Beyond the Gloves emphasizes youth mentorship and development, equipping young people with the tools they need to thrive, avoid substance use, and prioritize their health and wellness. The Street Outreach Network focuses on gang prevention and intervention, offering at-risk youth alternatives to gang involvement while connecting them to critical mental health and substance use resources. By investing in these programs, we address the immediate and long-term impacts of the vaping epidemic on our most vulnerable populations. We not only curb vaping and discourage substance use, but also create pathways for healthier, safer, and more equitable futures for Black and Latino youth in high-impact areas. This is a vital step towards ensuring the health and well-being of our entire community. In addition, you will also hear that we propose a series of community grants focused on high-impact areas. Also, just to share some of the percentages, this is looking from the Youth Behavioral Risk Survey. This is data trends 2013 to 2022. Again, the survey is completed every other year. Data is released in even years with a 2-year delay. So in 2024, we received data from 2022. Less than 2% of middle or high school students reported use of cocaine, steroids, heroin, meth, or ecstasy in 2022. The survey did not ask specifically about opioids or fentanyl. The most recent data is from the 2021 to 2022 school year. Just to look here, this is percentage of middle and high schoolers who currently smoke. Montgomery County is in blue for middle school and orange for high school. We can see middle schoolers is less than 2% and high schoolers is less than 4%, consistent with state trends. On the upper right, we see middle and high school students who currently drink alcohol in Montgomery County and Maryland. Again, middle school, Montgomery County Middle School in blue and Montgomery County High School in orange. We see middle schoolers at right about 5% and high schoolers at right about 15%, a little bit lower than the state average. When we look at middle and high school marijuana use, for middle school, again, about 2.5%, and for high school, a little over 10%, both lower than the state average. And in the lower right, when we look at middle and high schoolers who ever took prescription medications inappropriately, we see for middle schoolers and high schoolers, they are at about the same, both at about 8%. So those are the trends that we see in those. I also just want to caveat this. Part of the reason I showed this slide, the data that we showed earlier on substance use shows the worst of our teens, and I want to remind us that we have a lot of resilience in our teens, and so we often focus on the data that is most shocking, but Montgomery County students have the highest graduation rates in the county. We have the highest rates of kids going to college. We have very low rates of drug use overall, and so it's important that we're looking at our kids in context. So just a little bit about the appropriation. For rec mode, what is proposed is $250,000 to support the Beyond the Gloves program, which provides mentorship, access on health and wellness resources, really focusing on fitness and keeping your body well. And $100,000 for Street Outreach Network to enhance their daily outreach, after-school programming, connecting to health, mental health, and substance use resources, focusing specifically on youth residing in the Enclave and in the broader East County region. We're also proposing a series of dual Atria Community Awards. This would be awarding up $1.3 million to up to 3 organizations. We will be asking organizations to submit their proposals of innovative community-based strategies that promote vaping cessation, mental health support, and substance use prevention. The grantees must demonstrate a focus on prevention and mental health. They must promote youth engagement. They must show a collaborative approach. Because it will only be a maximum of three organizations, we expect that those organizations to be collaborating with smaller organizations, helping to encourage them and give them support so that they can, a smaller organization probably wouldn't be able to manage that large amount of money, so we are hoping that those larger organizations will also be providing mentorship to the smaller organizations that are more on the ground in the community. We expect to show experience with Black and Latino and Hispanic youth, to utilize a positive youth development framework, to offer family caregiver education and support, and focus on high-impact areas. These are all things that we've heard from our variety of listening sessions with youth and parents of what they really need in terms of support for substance use. Those high-impact areas include the Aspen Hill, Briggs Cheney, Gaithersburg, Old Town Gaithersburg, Germantown, Glenmont, Montgomery Village, Silver Spring, and Wheaton. The timeline for appropriation of funds. Disbursement could take 8 to 16 weeks, depending on the extent of council revisions, awardee responsiveness, administrative workloads. We've already been in contact with Raphael from the Office of Grants Management, so that, as soon as council approves, we can get the notice of funding opportunity out on the street and start educating partners around that opportunity. The application phase will be for 4 to 6 weeks, and then review and scoring. So hope to be able to get funds into the community quickly, with the idea being that programs could have things in place before the summer. And just a summary on the Jewel and Altria settlement funds. So the county expects to receive about $4.1 million in total. 3.1 of that has been received to date. We have received our full payment from Altria, but we are expected to receive additional payments from Jewel in December of 2024, 25, and that should say 2026. As of yesterday evening, we had not yet received the December 2024 payment from Jewel. The exact amounts of that payment, so the gap between the 3.1 and the 4.15, we expect it to be about $1.05 million, but that exact amount will depend on whether there's additional lawsuits that are filed against Jewel. Okay, and any questions?
Great, thank you. Yes, a couple of questions from me, and then I'm going to turn to Councilmember Sayles first this time for this round, followed by Councilmember Luedtke. So obviously, and unfortunately, it's great that we have these funds, but they have an expiration date. So how are we taking into account that these are one-time funds to ensure that we're setting everybody up who receives them for success, but the challenge will be knowing that they will go away at some point and in the not-too-distant future?
Yeah, that is the unfortunate, reality of the one-time funding. So, when we're looking at the community awards, that will help for this year. We hope to be able to take some of those best practices, if we see awards, programs that are really fantastic and amazing, to use that for the impetus to what we fund in the future. That's why all of the funds have not been appropriated already, because we want to see what's working well and what's not, and be able to use that to guide future investments. I'll also say that the focus, we really do want the focus to be on prevention, and so trying again to make sure that that's where the priority goes. We have seen the decrease, and hopefully a large investment up front, which is what we're doing here, will allow us to have smaller investments in the future when we're thinking about the treatment arm of things.
Great. And I appreciated your comments about wanting to encourage leveraging these resources so that there are partnerships and alliances when people apply for these grants, which is good. Who will be reviewing and who will be scoring the applications that come in?
So that will be, we're working with Grants Management on developing that list of folks. It will be a combination of DHHS. We'll also have community members, the folks from behavioral health. The challenge is we don't want community members who are also applying for grants, but it will be a subset of folks who are in the substance community. I imagine that several of them will probably come from the OPT committee.
Great. Thank you. I may have a couple more questions, but I want to yield to colleagues. And just a reminder, we're going to try to end as close to 11 as we can so we can hit the road to Glen Burnie. Councilmember Sayles.
Thank you, Mr. Chair, and thank you again, Dr. Davis, for the updates regarding the ruling. Prevention has a lot to do with public health education, and a lot of these programs are already experienced in providing health education and prevention education. I know that you mentioned the criteria that would be used to select the grants. 2 have already been pre-awarded. How many organizations were evaluated in totality before the grants were?
So Street Outreach Network is an existing program within
Yeah.
DHHS, and so because of the work, the strong work that they have been doing, encouraging additional support for them as they've been doing the on-the-ground work. Rec Mode was a program that has been in existence. There have not been funds to be able to provide them the resources that they need. We have seen them to be very promising and had been previously vetted. To Councilmember Albornoz's question, part of the funds for Rec Mode is also to help them build some of their infrastructure to create that sustainability going forward. They have shown strong impact in the community, but have not had the support to be able to expand that more broadly in a way that's just not programmatic, and so giving them some of the flexibility to create that. The goal of the community awards is to find the more promising programs that haven't risen to the surface yet. In many of the conversations that we did with the listening sessions, and also some of the conversations that I've had on the youth safety front, have heard of a lot of smaller programs that aren't getting to the attention. And the goal of the community awards is really to help those smaller programs who are doing good work in the community, who haven't had the ability to compete for the bigger grants, to get support from some of the larger organizations to really see the light of day and emphasize the work that they're doing.
Thank you. How are these programs going to track and evaluate the data regarding vaping usage, vaping cessation successes, and do any of the existing organizations or the ones that we're going to be considering, do they have any pre and post data available to document their success rates with vaping cessation?
I don't believe any of them have been tracking their vaping rates currently, but that would be part of the award, the requirement to track, current and the status of vaping.
Okay. I noticed.
Good morning, once again. For the record, Luis Cardona, Administrator for the Positive Youth Development Program. Just to add to Dr. Davis' response and in response to you, Councilmember Sayles, we just recently hired a data manager in the PYD program who is actively working to develop those type of processes for us. As probably Councilmember Albornoz knows better than anybody else, that's been an area of need for PYD in general. And we do believe, in light of the fact that the Rec Mode grant would most likely be in the PYD space as well as the SUN program, that we have the basic tools that can help us to get to that point. Because again, PYD, we're not subject matter experts in substance abuse, but our strengths are really in community engagement with young people and families. So.
Yeah, I know this is going to be a evolution of the work that you're doing, so I'm glad that you're already, thinking about the needs before you start implementing the programs. I noticed that Rec Mode included the number of youth they're expected to serve. Are you able to share how many youth the Street Outreach Network will be able to share with this particular grant?
So besides the East County area, more specifically the Enclave community, we're also looking at some other communities as well. And our hope is that because the Sun has been partnering with Rec Mode for a while, that this can continue to build off those relationships that we built with them for the past couple of years. So typically, we've served anywhere from 30 to 60 kids who have participated in programs in Rec Mode. So our hope would be to expand that. I mean, I could throw out numbers right now, but it's really difficult to say because when we first started that partnership with Rec Mode, we were just taking about 10 young people from the Up-County area. Since then, we've had Mid-County staff and even East County staff who have now been taking young people there. And, kudos to Dave Kennedy and his wife because we have had no way of compensating them. They've done this in good faith on behalf of county residents and children. And so, we believe that this helps to do things in a right way, because they've really put in good work.
Yeah, they're mentioning hundreds of students that they'll be able to reach in their hybrid program. So I just want us to think about how many people we're actually going to be able to reach and if additional resources would be necessary. And if you have any insight on the Rec Mode program, I know one of their goals is to improve youth trainer competency with Train the Trainer continuing education workshops. Do we know who's providing these trainings and what qualifications these trainers have?
Yeah, so there's several different trainings that they've put in place. To their credit, they RecMo staff have already participated in the bill training that we fund through our youth safety initiative already. They have also gone through the National Compliance Network evidence-based curriculum, Joven Noble curriculum training as well. But then there's a number of other trainings that they are really putting into place to help build the capacity and skill sets to ensure cultural proficiency in the service delivery. So, parts of that does include the physical fitness part, but other components definitely includes addressing the needs of each diverse young person that's going to step foot into there.
Yeah, if we can get more information about their training and experience in cessation, vaping cessation successes. And then can anyone clarify how these hybrid classes work? Because I thought this was a boxing program. I know it's has some mentoring aspects to it.
Okay, yeah, so the hybrid, they already currently implement this in the community at schools and some of the community rec centers. They've done some East County. They're looking forward to providing opportunities outside of their headquarters, which is located in the Wheaton, Glenmont area. And so that's their approach, with the hybrid model. But remember, this is a nonprofit entity, a small mom and pop shop that really gets no funding other than a recent contract from behavioral health, right, that they've been doing with Ben Stevenson. So aside of that, this is a great opportunity, as Dr. Davis alluded to earlier, to build their capacity and expand their services and to help make sure that it's a sustainable effort.
I'll also add just the hybrid benefit. So yes, you can't box virtually, but the benefits of the program, the mentorship, the keeping connections. And so part of the goal is also to stay connected to kids even when they can't be there on site. And so helping with the transportation, again, for the folks who are up county, to still be able to engage them in meaningful relationships with folks even when they can't be there in person.
All right, thank you.
Thank you. Councilmember Luedtke.
Thank you. And kind of following up on some of the questions that Councilmember Sayles was asking, I'm going to be candid. I had concerns that the rec mode portion of this and the street outreach network portion of this were a bit attenuated from what the intended purposes of the settlement agreement is, right? The restitution and remediation language, and not saying that there's something wrong with those programs, just that does the shoe fit the foot, if you will, for what the settlement called for, and because of that, I want to highlight the language in the settlement agreement. And it does say that the amount paid to each settling state shall be used for any lawful purpose. It says expressly that it is the party's intent that the payments be used to the maximum extent practicable to fund the following programs. Programs that provide cessation assistance to Maryland residents who were exposed to, and it uses the term ENDS, electronic nicotine delivery system, while under the age of 21. Education or prevention programs that are designed to prevent or reduce use of ENDS by Maryland residents who are under the age of 21. Research in support, right? Programs or equipment that are designed to abate the impact that ENDS and other nicotine products have had on Maryland students, schools, school districts, and to prevent such impact in the future, and efforts to mitigate the impact of, including by enforcing Maryland and federal law with respect to disposable electronic nicotine delivery systems, synthetic nicotine products, and companies that have not taken steps similar to those described in this consent judgment to limit access to or usage of nicotine and nicotine synthetic products by Maryland residents who are under the age of 21. Now, some of the folks who were exposed and became addicted under the age of 21 are now young adults, right? Because it's been going on for a hot minute. And I don't see that anything that is in this appropriation deals with that now young adult population who had those exposures pre-21 to these products that these companies profited off of, and what are we doing with that group? So could you explain how any of these 3 programs will assist that population?
So the Community Awards program can go up to a higher age group, so they
Okay.
so that can impact that population. I will also call attention to that we did work with county attorney on
Right.
On the interpretation. There is certainly evidence that youth who are disconnected, low income, no lack of resources are more likely to vape and more likely to suffer the consequences. Their communities are more likely to have vape shops in them and more likely to suffer the negative outcomes. And so that's why we have really tried to focus on those youth in that community. There are also many examples across the country of communities using their dual settlement dollars to impact youth in terms of a prevention space, community supports, mentoring, addressing mental health challenges in many of the ways that we are doing. And that was really, those examples were really used as the backbone for these proposals.
Yes, and if I could just add real quickly, we have seen firsthand, specifically in the enclave community, where there is a high number of young people that have been exposed or involved in a lot of high-risk behavior to vaping as well. So because we're already engaging with that population, it kind of behooves us to say, hey, look, now we have to respond to this particular need. Although our mission is really focused on the gang population, our concern is not to make sure that it doesn't get any worse for them or for the community by utilizing these resources in our engagement.
Right, but and specifically with the Street Outreach Network, as you said just a moment ago when you were answering Councilmember Sayles' questions, you don't have someone within Sun who does cessation work or who can actually, you don't have any clinicians, so you're going to be referring them to someone else, right?
Yes, that would be the case. But do keep in mind that sometimes it's about how do we help build the coping skills for young people to deal with what they're doing. And so I can go back to a couple years ago during the pandemic where one of our staff person had implemented a gardening program. And so a couple of the young ladies who were involved in that program, believe it or not, had shared that it's the gardening in and of itself is helping to address that,
Right.
giving them that fix.
Right.
So yes, we want to make sure that they're getting the resources in Monica's shot, right? But we also want to, make sure that we are taking the responsibility because we're doing the primary engagement to provide them some level of supports and safe space for them to begin to understand what safe coping skills are, so they can look at self-medication because that's what this is all about, right?
Right.
In a different way.
Right.
And it's also referring them to within public health.
Right.
So we have
Right.
a tobacco cessation program, and so they don't necessarily have to have the expertise. We've got the expertise in community and population health within the public health service. So a lot of it is referring them to the programs that are already in existence. The program is small and so doesn't have nearly the reach to be able to get to the communities that the Street Outreach Network team is getting to.
Right. So, okay. So to your point that the cessation program inside public health is small, was any consideration given to using any of this funding to expand that program?
In this appropriation now, no, but we would hope in future appropriations to be able to expand that program.
With the future settlement funds? Yeah, okay. And with respect to the 3 intended community grant partners, do you have a NOFA already drafted related to that?
Yeah.
Sorry, notice of funding availability.
Yeah.
Sorry. Is that something that you would be able to share with the committee for review?
I will have to talk to Raphael if he feels comfortable sharing it.
Not for us to disseminate, but for us to see the criteria that's being used for applicants to apply and how that would work, as you noted, with the smaller organizations. I'm assuming there's language in there that specifically addresses them and what they are allowed to do in terms of giving out to other organizations awards that are made by the county versus what they can't do. So I just think it would be good for us to have a clearer picture of that, and certainly the language that's in there would give us that view. Thank you.
Thank you both. I'll just make a couple of comments. We're on time. Thank you. Those were great questions and appreciate the responses. So I'm having a flashback to the most recent summer peace event I attended at the Enclave this summer, and where I saw Dr. Davis. And it's just, it's remarkable the progress we've made. I've had the opportunity to see it from when the Street Outreach Network was first formed to where we are now, and the collaboration and partnerships, the trust we've been able to establish with a lot of folks within the community are profoundly important, hard to quantify, but profoundly important, because it sets the stage for us to be able to utilize funds, leverage them as much more effectively than in other jurisdictions, and I've worked in several. So obviously a lot more is going to need to be done. But I have a high degree of confidence in the team that's on the ground and the relationships and partnerships that have been established. We will have follow-up conversations on the youth development initiative that the executive has been working through, you as the leader on, Dr. Davis, as it's related obviously to this work, but I appreciate your responses. So I think without objection, or I'll put it up, can I get a motion to approve the appropriations as requested?
So moved.
So moved, second. All those in favor? All right, that is unanimous. So thank you all very much, and stay warm out there.